This episode is adapted from a clinician-written article on Mentalyc and brought to life in audio for therapists who prefer listening on the go.
I love that. Sometimes you just need to listen while you're driving between offices or grabbing coffee.
Exactly. And this piece was written by Nuria Higuero Flores, a psychologist, and we're really excited to feature their perspective here.
Wonderful. I'm ready to dive in.
Great. And just for context, if you're new to Mentalyc, it's a clinical intelligence platform that supports therapists with documentation. So, let's talk about something that I think a lot of us have a complicated relationship with, therapeutic contracts.
Oh, the contract. The thing we all know is important, but sometimes feels like the legal paperwork you have to get through before you can get to the real stuff.
Yes, that's exactly it. You just want to connect with the person in front of you, and suddenly you're talking about cancellation policies and fees. It can feel so transactional.
It can. But I had this experience years ago with a new client, and we were both sort of eager to jump in, so I kind of breezed through the contracting part. And about 3 sessions in, there was this rupture, a total misunderstanding about what the work was going to look like. He thought I was there to give him direct advice, like a consultant, and I was trying to do this deep exploratory work.
Oof, I felt that in my gut. The classic misalignment of expectations. It's one of the biggest reasons for premature termination, isn't it?
Absolutely. And it was all because I rushed the foundation. We hadn't built the container properly. It taught me that the contract isn't the barrier to the therapeutic work. It's the beginning of it. It's the first act of creating what Winnicott called that safe space.
Yes, the therapeutic frame. It's not a rigid box, it's a sturdy container. It's what tells the client, hey, this space is predictable. This space is safe. The world outside can be chaotic, but in here, you know what to expect. You know the boundaries. You can let go.
Exactly. Think about a client coming in for severe anxiety. Their whole world feels unpredictable and threatening. Just the simple act of saying, we will meet every Tuesday at 10 a.m. for 50 minutes in this room, and what you say here is confidential within these specific limits, that in itself is a therapeutic intervention.
It's a form of containment. You're giving their nervous system a place to land. You're saying, for this 1 hour, you don't have to guess. You don't have to be on high alert. That's when the real risk-taking in therapy can start to happen.
And it respects their autonomy. You're not just imposing rules, you're co-creating the terms of the relationship. The contracting process itself can be so revealing. If you have a client who has trouble with boundaries, how they engage in the contracting conversation. Do they push back? Do they agree to everything too quickly? That's all data.
It's true. It's like a mini diagnostic right at the start. I once had a client who, when we discussed the cancellation policy, became incredibly apologetic and anxious. It opened up a whole conversation about his fear of disappointing people and his patterns of people-pleasing. We hadn't even gotten to the presenting problem yet.
See? The work had already begun. So let's break it down. When we talk about contracting, it's not just one thing. I find it helpful to think about it in different layers or types. There's the practical stuff, the professional goals, and then the really juicy psychological layer.
Okay, let's start with the practical. The administrative contract. This is the nuts and bolts, right? The business side of things.
Right. Fees, scheduling, location, whether it's in-person or virtual, cancellation policies, all that foundational stuff. And it can vary so much depending on the setting. If you're in private practice, you have a lot of flexibility. If you're in an agency or doing EAP work, some of that is already decided for you.
Oh, definitely. I remember working in an EAP setting where it was strictly 6 sessions covered by the employer. That had to be front and center in the contract. Our time together is for these 6 sessions. Let's define what we can realistically achieve. It changes the scope of the work entirely.
It absolutely does. And that clarity prevents the client from feeling abandoned or cut short at session 6. They knew the frame from day one. So that's the administrative piece, But then you have the professional contract.
Right. This is the what are we actually doing here part, the therapeutic goals. This is where we define the purpose of the therapy.
Exactly. And this is where that earlier story of mine went wrong. My client's goal was fix my anger, and my goal was explore the roots of your anger and develop coping strategies. Those are two very different things.
So different. One implies a passive fix. The other implies active, collaborative work. A good professional contract might sound like, okay, you're struggling with self-doubt at work. So our work here will focus on exploring where that self-doubt comes from and practicing new assertiveness skills in our sessions. It's specific. It's a well-defined course of action.
And it's a living document, right? That professional contract might need to be renegotiated. A client might come in for workplace anxiety, but 3 months later, we realize the core issue is actually unresolved grief. So we pause and say, hey, it seems like the focus is shifting. Does it make sense for us to adjust our goals and contract to work on this grief directly?
That check-in is so important. It shows you're listening and adapting, not just sticking to the initial plan. Okay, so we have the administrative frame, the professional goals. Now for the juicy part you mentioned.
The psychological contract. This is the big one. This is all the unspoken, unconscious stuff that both the client and the therapist bring into the room. It's not written down anywhere. It's felt.
The undercurrent, the assumptions, the hopes and fears that are floating in the space between us.
Precisely. A client with a history of abandonment might unconsciously expect you to eventually reject them. That's their psychological contract. Therapists, like everyone else, will eventually leave. So they might test you. They might show up late or miss a payment, unconsciously waiting for you to fulfill that prophecy.
And on our side, we bring one in too. The classic rescuer therapist who unconsciously wants to save every client. Their psychological contract might be, my worth as a therapist depends on my ability to fix this person's pain. And that can lead to overfunctioning, extending sessions, or getting enmeshed.
Exactly. And good therapy, great therapy, happens when we can start to notice and gently name these psychological contracts. When you can say to that client, I notice that whenever we get close to something painful, things come up that make it hard for you to make it to our next session. I wonder if there's a part of you that's worried I won't be able to handle it, or that I might give up on you.
That's when the magic happens. But it's so hard to track those subtle shifts in the alliance, isn't it? In the moment, you're tracking the narrative, the body language, your own countertransference. Trying to also spot the emerging psychological contract is a lot.
It is a lot. You can feel it, but it's hard to pin down. It's why I've actually been finding tools like Alliance Genie from Mentalyc to be so interesting for my own reflection. After a session, I can get these objective insights about the relational dynamics. Like, it can highlight moments of high client engagement versus moments where there might have been a subtle rupture or disengagement. And the best part is, it does this without ever storing the session audio or video, so it completely respects confidentiality.
Oh, wow. So it's not about judging the session, it's about giving you data points for your own reflection, like a mirror for the alliance itself?
That's a perfect way to put it. It helps me reflect on those very psychological contract moments. I might see a dip in engagement and think, that was when I brought up her mother. That's where her unconscious expectation of being judged might have surfaced. It just sharpens my focus for the next session.
That's a fantastic point. And for anyone listening who feels that pressure of tracking everything, the notes, the plan, the alliance, it can be overwhelming. Let's just take a quick pause here. If this part of the work feels familiar, Mentalyc can help. Its AI note taker supports your documentation and clinical judgment while staying fully HIPAA and SOC2 compliant. You can explore it at Mentalyc.com.
Right. And having that documentation support frees up more mental energy to focus on these deeper dynamics we're talking about, like adapting the contract itself.
Yes, let's talk about adaptation, because a contract is not one size fits all. I'm thinking specifically about cultural background.
Oh, this is critical. Our very Western individualistic model of therapy, with this emphasis on strict individual confidentiality and emotional boundaries, doesn't always translate. I worked with a client from a collectivist culture, where the family's involvement in healthcare decisions was the norm. It was expected.
So the standard confidentiality clause, I won't talk to anyone, not even your spouse or parents, could actually feel isolating or even disrespectful to that client.
It did. It created discomfort, so we had to negotiate. We had a conversation about what confidentiality meant to him and his family. We agreed on what information could be shared in a family meeting with his consent and what would remain just between us. We modified the contract to respect both the therapeutic boundaries and his cultural values. It requires humility from us as therapists to not assume our standard contract is the right one.
Humility and curiosity. We have to be willing to ask, what does commitment look like in your culture? What does privacy mean to you? And the setting matters too. We touched on agency versus private practice, but what about something like crisis intervention?
Oh, completely different ball game. In a crisis situation, the contract shrinks down to one primary goal: safety. The contract is about right now, for the next hour, my job is to help you stay safe. Can you agree to work with me on that? All the other stuff, long-term goals, exploring childhood patterns, that can wait. The contract is immediate and focused.
And then there's group therapy, where it's not just one contract, it's a web of them. You have the contract between you and each individual member, but you also have to facilitate a contract among all the group members themselves.
The group confidentiality agreement. What is said in group stays in group, and that's a huge one to build trust around. You're also contracting around giving and receiving feedback, not interrupting, using I statements. It's so much more complex.
It really is. Something else I see trip up new therapists is the difference between the therapeutic contract and the therapeutic plan. They often get used interchangeably, but they're distinct.
They are. I think of it this way. The contract is the framework of the relationship. It answers, how often will we meet? What are the boundaries? How will we handle confidentiality? The plan is the roadmap for the work itself. It answers, what specific techniques will we use? What are the steps to address your goals?
That's a great distinction. So the contract might say, we agree to 6 initial sessions to focus on managing your depression. The corresponding plan would say, okay, for these 6 sessions, our plan is to use behavioral activation in sessions 1 and 2, then introduce cognitive restructuring in 3 and 4, and focus on relapse prevention in the final 2.
Exactly. And the plan is much more fluid. The plan might change every few weeks as your understanding of the client deepens. The contract, that foundational framework, tends to be more stable, though it can still be revisited.
That makes so much sense. It's like the contract is the kitchen we agree to cook in, and the plan is the recipe we decide to try today, knowing we might need a different recipe next week.
I love that analogy. And now, our kitchens are increasingly virtual, which adds a whole new section to the cookbook.
Telehealth, yes. The contracting around the online therapy needs to be so explicit about things we never had to consider before.
Right. Like, number 1, what is our backup plan if the technology fails? If our Zoom call drops, will I call your phone immediately? Will we try again in 5 minutes? Having that plan prevents a dropped call from feeling like a therapeutic abandonment.
So important. And contracting around the client's physical environment. I need you to agree to be in a private, stationary space where you won't be overheard or interrupted. You can't have someone doing therapy while driving or sitting in a coffee shop. It's not safe or contained.
Absolutely not. And the emergency contacts. When they're not physically in your office, you need to have a clear, contracted plan for what happens if there's a safety crisis. I need to know your physical location at the start of each session and who I can contact for a wellness check if I become concerned for your safety and lose contact with you.
It's about recreating that therapeutic frame in a virtual space. It takes more intentional effort and a much more detailed contract, but it's doable.
You have to explicitly state the rules of this new kind of space.
It all comes back to that, doesn't it? Whether it's in person, online, in a crisis, or over 6 months, the contract is about creating clarity, security, and a shared understanding. It's not just an administrative formality, it's the bedrock of ethical and effective practice.
It really is. When it's done well, when it's a collaborative conversation instead of a lecture, it sets the stage for everything else. It's the first and most fundamental way we show the client, I'm here with you. We're in this together. And here's how we're going to make sure this journey is a safe one.
Balancing that structure with flexibility, being sensitive to culture and individual needs, that's the art of it. It's about establishing a framework that allows both of us, therapist and client, to show up fully.
So if there's one practical takeaway from all this, maybe it's just to be more intentional and curious about the contracting process. Don't rush it. And maybe even a few months into therapy, check back in. Just a simple question. Hey, I just want to check in on the structure of our work. How is this pace feeling for you? Are our sessions feeling like a safe and useful space?
I love that. Reopening the contract conversation isn't a sign of failure. It's a sign of a healthy, evolving therapeutic relationship. It shows you care about their experience of the process, not just the outcome.
Exactly. It reinforces the collaboration. This has been such a good conversation. It's making me want to go back and review my own contracting language.
Me too. It's a practice that always deserves refining. And if you are looking for support and reflecting on those subtle alliance patterns we talked about, especially that psychological contract piece, a tool like Alliance Genie can really help with that reflection, all without storing any sensitive session data.
A fantastic reminder. Well, thank you for digging into this with me. It feels so foundational and so important.
Always a pleasure. Thanks for the great chat.